Hello everyone, welcome to Sharmit. In this session, we are going to talk about another topic related to medical coding anatomy, where we will be studying about the bilateral anatomical term of direction. In our last session, we talked about other type of anatomical term of direction like ipsilateral, contralateral, right? So this session is in the continuation of the same, where we will be mainly focusing on the bilateral. So we will proceed in the same way. Firstly, I'll explain you what is bilateral. Then we will go through some of the definitions and we will try to understand the meaning of this word, right? And later on, we will talk about some of the important examples that will help us to understand what is bilateral anatomical term of direction. Also, I will provide you some tricks that will help you to remember these concepts during your interviews and examination. And as usual, we will also talk about some of the examples as well, questions as well for the interview. But before we proceed further with these things, I would like to recommend you to please go and check out the previously released session first, because they all are in proper sequence and sync. So if you follow it sequentially, then it would be much more easier for you to understand the ongoing topic. Because for time being, we are just mainly focusing on bilateral, but prior to that you should know about the other thing. And for that you can do one thing. You can refer the Sharmit digital course book, which is freely available in the description box. There you will find thousands of sessions available in Hindi as well as English language, and there is a particular tab for medical coding where you will find all the required resources in both languages. So without any language barrier, according to your requirement, you can easily consume the content. And in case if there is any question or queries related to that, you can simply reach out to me through my comment section so that I can help you to try to fix your issues. Clear? Alright, so let's get started and see what is bilateral. So we will start from the definition itself. So definition says bilateral means occurring on the both side of the body. Okay, so if something is occurring on the both side of the body, then we will denote it as a bilateral. Okay, so you can say that whenever a structure, a condition, finding or a procedure affect the both right side and the left side at the same time, then it is described as a bilateral. Okay, so bilateral means both side of the body. Now, if you look at the word carefully, you will see that it comes from the Latin that is composed of two terms, bi and lateral. So bi means two, lateral means side. Okay, so bilateral is the two side. Now we all know that every term has its opposite term as well. So for bilateral we have opposite term, that is unilateral. Okay, so bilateral means both side and unilateral means one side only. Okay, so bilateral is both side, unilateral is one side only. So these two work always, these two terms always work as a pair. You cannot understand one without knowing the other one. Yeah, that is true. So if you are following, like if you are learning all terms, so you know that every term has its meaning and its opposite term. So if you know both the terms, then things are much more relatable. Correct? Fine. Now let's see the examples. So first example says bilateral knee pain means both the right and the left knee hurt. Okay, so if a patient is diagnosed with bilateral knee pain, so we can assume that he was suffering from left and right knee pain. Then we have unilateral knee pain, means only one knee, either the left or the right hurts. Clear? So these are the some best example. Now let's see more example to get some clarity. So here you can see there are some comparison examples which will help you to understand the things properly. The first sentence says the patient has bilateral knee osteoarthritis. Okay, which means both the knee and both the right knee and the left knee shows sign of osteoarthritis. Okay, so it is clear because here we are talking about bilateral, that means both side, right side as well as left side. The next thing is bilateral pneumonia was seen on the chest x-ray. Okay, so let's say if there is a patient who is suffering from bilateral pneumonia and he was x-rayed, so in that case we can say that during a report we found that infection was present in both right lung as well as left lung. Okay, so the surgeon performed, like the next example is the surgeon performed a bilateral mastectomy. Both the right breast and the left breast were surgically removed. Then in that case we can say it is a bilateral surgical operation. Why bilateral? Because both sides have been impacted through that mastectomy. Clear? Next we have is bilateral leg edema suggests a systemic cause, which means swelling in both legs point toward a cause like heart failure rather than a local injury. And the last example says the patient reported bilateral hearing loss over several years. Okay, so in that case what will happen? A hearing has decreased in both the right ear as well as the left ear gradually. Now just tell me, what is the common thing between all these sentences? The common thing is bilateral. Okay, and in this column of meaning you will see that the common thing is the both side, right? Because bilateral means both side. So if something is denoted with bilateral, that means it is impacting the both side of the body. Okay, so this is how you will identify bilateral related things. Now we have next example, like these examples are done. So let's see how it is used in medical coding terminology. Okay, so here you can see I have noted down couple of medical terminology related things like bilateral pneumonia, which means a lung infection present in both lungs, right? Then next is bilateral hydronephrosis, which means swelling of both kidneys due to obstruction. Okay, so look at carefully, like here we are talking about swelling in both kidneys. So whenever this both term is there, that means we are talking about two parts, right, at the same time, and that is called bilateral pneumonia or bilateral hydronephrosis. Okay, so it totally depends like how you are utilizing this term. If it is related to both thing, then we have to utilize it. Okay, so I think this part is now clear. Now we are going to talk about the next example, that is bilateral salpingo-oophorectomy. Okay, which means surgical removal of both ovaries and fallopian tubes. Similarly, if you look at the next example, that is bilateral knee arthroplasty, which means surgical replacement of the both knee joints. So in all these examples, one thing is clear, that whenever we are using bilateral, it means we are talking about the both sides at the same time. Clear? Fine. So I think now we have clarity on this part. So let's move to the next thing, that is memory tip. So as you all are learning these so many concepts at the same time, so how you will remember it? Okay, so that thing we need to know, like how we are going to remember this for so long. So for that, what I did, like I created this memory tip where you can simply see that bi equal to which is 2, right? So just think it as a bicycle which has two wheels. So bilateral means bi plus lateral. Bi means 2, lateral means sides. So just imagine it as a bicycle because it has two wheels, right, working together. So similarly, if you look at the word bilateral, it starts with B, right? B for both sides. So just denote bilateral B with both sides. Now you know there are so many common examples where this bilateral thing can be relatable. How? Bicycle because it has two wheels, binoculars because it has two eyepieces, bilingual because it has two languages, and bilateral because it has two sides. Okay, So in all these example, one thing is common, that is by. So wherever we are using by, that means two means both side. Clear? So yeah, this is how you will create this this is how you can create a relation between the terms that is related to bilateral. Okay, now for today there is one question, so I'm just sharing the question here. The question is, what is contralateral anatomical term of direction? I'm sure you already know the answer of this question, so please do share your knowledge in the comment section so that others can take a reference from it. But in case if you don't know the answer, it's completely fine, because this thing we have already discussed in our last session in detailed manner. So from there you can learn this session again, and then you can share your knowledge, because when you write answers in the comment section, it will also instruct me that you are learning from this series, and then I will publish more sessions related to it. Okay, so please do share your knowledge, because it will allow me to publish more sessions, and also it will help other viewers to get the proper details from the comment section itself. Okay, so yeah, that's all for today. See you in the next session with new topics. So thank you for watching Tech Sharmit.